In 2021, a global scramble for vaccines was underway. Rich countries took more doses than they could use, pushing African countries to the back of the queue. But as uptake in their countries plateaued, they were forced to destroy millions of expired doses or donate those close to expiry to countries still struggling to acquire essential doses.
It is an indictment on humanity that more than 82% of the world's vaccine doses have been acquired by wealthy countries, while less than 1% has gone to low-income countries.
It is a very big mistake to think that the world may be secure while the African continent is still lacking protection against the virus and its variants.
Meanwhile, Africa had done the hard part. The Africa CDC and partners such as the MASTERCARD Foundation pooled together to accelerate access to and rollout of COVID-19 vaccines across the continent. By the end of 2021, vaccine deliveries were ramping up. But getting needles into arms presented a new set of challenges. A shortage of funds for in-country rollouts, limited storage capacity, and a lack of trained medical workers held back vaccination campaigns in different parts of the continent.
We seek to coordinate. There is no factory in the world today that can deliver you 400 million doses of vaccine at a go. And even if you did that, it will be challenging for countries to be able to use the vaccines. So our goal is that by December, Harvard would have distributed at least 70 million doses of vaccines.
To help drive vaccination rates, the Africa CDC and MASTERCARD Foundation immediately prioritized support to countries where vaccines were at risk of expiration, launching an aggressive campaign to boost vaccine uptake.
Drink lemon and bicarbonate. Oh my God.
Salt water, chloroquine.
With misinformation spreading rapidly across the world, it was clear that delivering credible information through trusted community sources would be central to the vaccination effort. Still, by the end of 2021, just 7 countries had reached the 40% vaccination target set out by the World Health Organization. They were setting the pace. Rwanda used detailed demographic data, leveraged technology infrastructure, and boasted exemplary government coordination and proactive public communication to reach its 40% vaccination target by the end of December 2021. Morocco mobilized healthcare professionals and mobile vaccination teams and set up many designated vaccination centers. They automatically assigned citizens or residents to the nearest vaccination center using a digitized identity number. Today, they vaccinated more than 80% of their population. For their immaculate efficiency, the Africa CDC designated the Institut Pasteur of Morocco and the Rwanda Biomedical Center as centers for excellence for COVID-19 vaccination. To achieve its vaccination targets and ensure long-term health security, Africa is now turning its attention to vaccine manufacturing.
Unless and until the continent is equipped with the ability to manufacture vaccines, therapeutics, and diagnostics, we will continue to be very vulnerable.
In 2021, at least 12 new vaccine production facilities had been set up or approved for development across 6 African countries. Building Africa's capacity to produce vaccines will be a game changer, not just for the continent, but for the world.
Reaction of the international community to COVID-19 is much improved compared with what we faced when Ebola struck.
The beauty of this is that, Africa had learned from some lessons. We are not, waiting for somebody to give us those solutions. We have them now.
The difference between success and failure lies in building a robust public health infrastructure that can confront any health issue in a sustainable manner.
Let us tackle obstacles together and demonstrate to the world that Africa has the ability, the scientists and industries to provide the vaccines, the therapeutics and diagnostics needed to manage African health.